Hello and welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in this episode, we discuss low-carb diets. Now, a simple Google search or jaunt through social media will show you that low-carb diets are getting a lot of attention, both as an effective approach to weight loss and a means to maintain good health overall. But what does a low-carb diet actually mean? What can you eat and what should you avoid? Are there risks involved? And who should avoid these diets? And finally, are low-carb diets sustainable for the long haul? To answer these questions, we turn to an expert on low-carb diets. Dr. Sher is a board-certified and licensed cardiologist. He completed his undergraduate studies at Stanford University and earned his medical degree from Ohio State University. He subsequently completed residency training in internal medicine at Mercy Hospital in San Diego and a fellowship in cardiology at the Scripps Clinic. Aside from his busy private practice in cardiology, Dr. Sher is also medical director of the site dietdoctor.com and hosts the Diet Doctor podcast. And now, without further ado, I bring you our conversation with Dr. Sher about low-carb diets. Hello and welcome to Better Man Clinics. Today we're talking about low-carb diets. Now, for most guys, if you're going to go ahead and do a Google search or go on social media to learn about low-carb diets, you're going to find a lot of information there. And frankly, a lot of it's pretty compelling, both in terms of weight loss as well as maintaining your health. But also, that information also leads to a lot of necessary and honest questions like, what can I eat and not eat? What does a low-carb diet even mean? And frankly, what do carbs even mean? And do I have to restrict how much I eat or when I eat? And more pressing questions like, is it safe? What are the risks for someone like me? And can I stay on a diet like this for the long term? Or is this just a short-term solution to lose a few pounds? Fortunately, to answer these questions and many more, we're very fortunate to be joined by Dr. Sher, who is not only a licensed and board-certified cardiologist, he's also an expert on low-carb diets. Dr. Sher, welcome to the program.
Thank you. It's a pleasure to be here. Happy to be here to talk about all these important issues with you today.
Thank you. I'm sure, I know I appreciate it. I'm sure our viewers and listeners do as well. Before we dive into the topic at hand, I'd love to learn a little bit more about you. I know you are a board certified and licensed cardiologist. You focus a lot on preventative health. What drove your interest and I guess later even passion towards a low carb diet in terms of promoting health? Or maybe it didn't. I'd love to hear more.
Yeah, well, it certainly didn't start off that way. You know, when I did my cardiology fellowship, it was a combined preventive and general cardiology fellowship. But the preventive cardiology part of it was in a Ornish style program. So it was very much low fat, high carb type of nutrition. And, you know, it was the whole program. So it was also, you know, exercise and managing your stress and quitting smoking and social connections. And there were so many other wonderful components to it, but a low fat diet was definitely part of it. Then I got out into the, you know, quote unquote real world and started practicing medicine. And really my focus has always been on prevention. But I started to notice that I just wasn't having the impact I thought I was going to have on my patients. And, you know, I'm sure many doctors have the same experience of writing in the chart, did not comply with lifestyle modifications or lifestyle interventions did not have the effect we wanted. So what's the next step? Here comes the prescription pad. Start writing drugs for blood pressure, for blood sugar, for cholesterol, because lifestyle, quote unquote, didn't work. Well, there's this old saying, you know, if you're in a classroom and one kid's failing, okay, you could probably blame the kid. But if 95 out of 100 kids are failing, maybe it's time to start looking at the teacher. And it took me a little while, but I eventually had to turn the spotlight on myself and say, well, maybe it's the message. Maybe it's the way I'm doing it. And actually at first I thought I just need more time. I just need more time with the patients to help them. So I started my own little wellness clinic, and I was working with a good friend of mine who was a health coach, to just really have, an hour for each patient. They were the health coach. He could just really work on them, and I could give him the guidance and the sort of the medical supervision. And fortunately, he was very well versed in ketogenic diets and ketogenic lifestyles. And so on some of our patients who are a little more challenging, he came up to me and said, should we put this guy on a keto diet and see what happens? And of course, my first response was, what, are you crazy? What, do you want to kill the guy? Right? Like that's what I'd been taught, that I didn't bother to look into it myself. That's what I'd been taught my whole career. And he, to his credit, he said, well, have you actually, looked into it and done the research? And so I did. And I was shocked that there was actual scientific medical literature research showing the safety and benefits of low carb nutrition. And I'd never heard of it. In fact, I'd been thinking the opposite all along. So I kind of did a deep dive and started learning more about it and reading books and reading the research studies, tried it on myself, and then said, okay, there's something here. So then started trying it with patients and started seeing the benefits. And all of a sudden, there's the old saying, once you see it, you can't unsee it. And that is so true. And I found myself, I kind of revitalized my whole career and my enjoyment for medicine, my enjoyment for preventive medicine, because my focus of helping people, or my ability to help people, was no longer just, patch you up when you're in the hospital and send you out. But now it really was enjoying lifestyle. Numbers are improving on lifestyle, losing weight, improving metabolic health. Now I'm writing those things in the chart instead of could not comply with lifestyle not having the impact we wanted. And it's a complete 180. And it was really eye-opening for me. And in a way, though, it was also very disappointing, because then I saw sort of the medical community, the medical teachings were still so anti-fat and pro-carbohydrate. And it just didn't make sense to me. So I wanted to become an advocate for this lifestyle. Not that, a low carb diet or a keto diet, and they're two different things that we can talk about, but not that it's right for everybody, right? I think that's sort of what got us into this problem in the first place, and saying there's low fat diet is the one diet for everybody. I'm not saying that, but I do want to scream it from the rooftops, because it should be an option for everybody. Even if it's not right for everybody, it should be an option. It should be something in every doctor's toolkit, or a nutritionist toolkit, or a health coach's toolkit, or personal trainer's toolkit, that they can use to help people get healthier. We have to be talking about it and thinking about it, because there is scientific backing and a whole lot of clinical backing that is safe and effective and can work in certain situations.
That's a very powerful story. It's a powerful combination of your personal experience with actual data-driven information. Kind of, oftentimes you miss one or the other, but you're putting the whole package together. Now, I'm going to take a step back and say what one of my classmates in medical school used to say every day to the professor. He goes, "Professor, I just need you to give me just the basics." Okay. So we're going to start off super basic, and, because not everyone's on the same level here in terms of understanding about diet and nutrition. If you can help us understand what, on a high level at least, what is a carbohydrate and how is that different from fat or protein, just so we can be on the same level playing field.
Yeah, so the three macronutrients, which you hear referred to as macronutrients, are carbohydrates, protein, and fats. And most foods are a combination of all of them, except for like oils can be like 100% fat, or, butter is mostly fat, things like that. But most are a combination of fats, proteins, and carbs. And the carb foods can be broken down into sort of, natural carbs, like, vegetables and fruits. Grains are obviously carbs. There's the starchy part of carbs, and then there's the fiber part of carbs. So those make up carbs, but they're very different in how your body handles them, because fiber can help sort of bulk up the food and stretch receptors in your stomach to help you feel full. And your body doesn't actually digest most of the fiber. It's not going to raise your blood sugar. It's not going to cause you to gain weight, and it's going to help just bulk up your stools and kind of pass through. Whereas the starchy part of the carbs, your body is going to absorb that and react to it. Now, how quickly it absorbs it, how your body reacts to it, that's very different for each individual. But the key concept is the more starch, and certainly the more sugar that is involved in that starch, and the more refined it is, the more it's going to impact your body detrimentally, meaning raising your blood sugar, raising your insulin, and probably causing you to consume more calories than you otherwise would. So I guess that's sort of an overall version of carbs. And then there, yeah, I mentioned the word refined. So an unrefined carb is you go out and you pick broccoli and you eat it, right? That's
Mhm.
unrefined carbs. Refined carbs is you take the wheat that's grown in this huge field and you grind it down so you just get the flour, and then you bleach the flour and you process it. That's a refined carbohydrate. So those are obviously very different things. So when we talk about low carbohydrate versus high carbohydrate, we also necessarily have to talk about quality of carbohydrates. And one of the good things that I really like about low carbohydrate diets is when you're sticking to a lower level of carbohydrates, you don't have a lot of room to add the refined or more dangerous, more harmful potentially carbohydrates. You usually stick to the unrefined, just vegetables and some fruits and maybe some legumes, and that's all you have for your carb allowance if you're eating a low carb diet. And that's certainly a much healthier way to eat than if you're just letting yourself go crazy with the carbs and then giving yourself access to all of the refined and less healthy carbohydrates.
So let me unpack that a little bit there. So you talked about three different types of carbohydrates. You talked about refined, which sounds like the worst kind, followed
Hmm.
by starchy, followed by unrefined, also like the fiber type of,
Hmm. Yeah.
carbohydrate. You mentioned for refined, it's basically highly processed, sugary kind of things. We can maybe put in like desserts and candies and white bread and stuff like that. Is that right?
Yes and no. Yes and no. So maybe I conflated the two, and I shouldn't have. So those are definitely an example of the refined carbs. Yeah,
Hmm.
but even bread is a refined carbs, and this concept of quote unquote healthy whole grains is really kind of a misconception because those can be refined carbs too. They
Hmm.
can have the term whole wheat, for example, is very misleading. Whole grain is certainly better than whole wheat, but whole wheat is a refined carbohydrate that's been stripped of a lot of the carbs have three things, the endosperm, and well, we won't get into all that, but um, it's been stripped of a lot of the good stuff and just left with the floury refined carbs. So even the quote unquote whole wheat bread isn't necessarily healthy. So it doesn't have to be sort of sugary dessert junk food. It can still be something that's masquerading as something healthy. That is a refined carb. Even like cereals, whole grain cereals, and things like that are refined carbs.
As well. And that's a great point. Now, what about the starchy variety of carbs? Can you give us some example of those, what that is?
Yeah, so some of the sort of starchier vegetables are like the below ground vegetables, sweet potatoes or potatoes, onions, parsnips, beets. Those are sort of starchier carbs, but still relatively natural carbs. And this is where, everybody wants to know, is this food healthy, right? Is this food good for me? And
Right.
and there is no black and white there for these types of foods, right? When it comes to like Coca-Cola or a soda, okay, that I can say black and white, not good for you, right? But sweet potatoes, parsnips, beets, even white potatoes, are those healthy for you? Well, they're natural, right? They're natural foods. They're whole foods. That's a great starting point. But for some people who are insulin resistant, meaning their body doesn't respond well to insulin, and little bits of starch can dramatically raise blood sugar. And there's this like big debate in nutrition. Well, eating too much sweet potato or eating too much potato didn't cause the obesity epidemic. Too many bananas didn't cause the obesity epidemic. And I agree with that. It probably did not. But that's different than saying removing those things is not going to help, because removing those things absolutely can help people who are insulin resistant, who have type 2 diabetes, who are very sensitive to these foods. And that's where individual testing is very important to see where you lie on that carbohydrate threshold. So you know what foods affect you more and which foods, avoiding foods or eating certain foods, are going to help your metabolic health the most.
Got it. And then finally, you had mentioned the I guess the good variety or the best variety of the carbs is kind of more the
Mhm.
fiber rich carbs that may not be absorbed as much. They help with digestion, with feeling full, giving you a sense of
Right.
satiety. Can you give us some example of those?
Yeah, so those are mostly the above ground vegetables, and we've got great visual guides at dietdoctor.com, where I'm the medical director. We've got great visual guides to show you, the different ranges of the vegetables and how much fiber and how much net carbs, which is total carbs minus the fiber, so you can get an idea of what lies where. But these are your leafy greens, these are your broccolis, your cauliflowers, your green beans, your zucchinis, your spinaches. Those are going to be much more of the fiber filled, lower net carb vegetables and carbohydrates that are pretty much healthy on any given diet. there's some debate about anti-nutrients and oxalates and things like that. That's a whole nother story. But for the overwhelming vast majority of the population, these above ground vegetables are going to be great additions because they're not going to raise blood sugar very much. They're not going to cause overconsumption of carbohydrates, and they can help with short-term satiety.
No, that helps a lot. So now at least we know that not all carbs are created equal, which is very helpful in terms of bucketing them. Now, you mentioned a bit about insulin, a little bit about blood sugar. I want to take it again down a notch in terms of just kind of understanding level. So based on the low carb, this principle or theory of low carb diet, why are those bad carbs, in other words, bad for your gaining weight versus consuming, let's say, the good carbs or consuming fat or protein for that matter? What is it that actually makes you gain weight or be unhealthy based on consumption of those specific bad carbs?
Yeah, and there are a couple of ways to answer that. I mean, the old saying is you're gaining weight if you're eating more calories than you're expending.
Sure.
That's the same as saying you're becoming wealthy if you're making more money than you're spending, right? It tells you what, it doesn't tell you how at all.
Right.
So simple carbs, refined carbs, they can stimulate you to want to eat more. There was this recent study by David Ludwig and his colleagues at Harvard. I did a video on it at our Diet Doctor YouTube channel. And it showed that those who were eating a higher carb diet were getting a stimulation in parts of their brain to make them want more, basically. So there's this debate, are carbs addictive? Well, addictive is a loaded term, but they certainly can have addictive tendencies in certain people. So that's one. You could just be stimulated to be eating more, certainly the more refined carbohydrates they are. But the other part is not just about calories, but how the food impacts your hormones, specifically insulin, and how it's going to impact your blood sugar. Because there was another study, interesting, that shows as you eat some of these refined carbohydrates, if you're sensitive to them, or any carbohydrates, if you're really overly sensitive to them, your glucose goes up, and then your insulin's going to go up, driving your glucose down. And as that glucose goes down, then you can become hungry again. So it's another way to stimulate you to eat more. So carbohydrates in that way can stimulate you to eat more. Now, importantly, it doesn't happen to everybody, right? And we can maybe unpack that a little bit more. And then the more you're eating carbohydrates, the more your body's requiring insulin to bring your blood sugar back down into a normal level, you get into this process called chronic hyperinsulinemia. So chronic meaning long-term, hyper meaning too much, insulinemia meaning too much insulin in the blood. So it means your insulin levels are too high. Now, insulin is a crucial hormone. We cannot live without it, because without it, you have type 1 diabetes and your blood sugar goes way too high. So insulin does a job by keeping blood sugar within this narrow range. But the more you're eating and stimulating your blood sugar to rise, the more your body needs to crank out more and more insulin. And it's sort of like if you're slowly turning the radio dial up for longer and longer periods of time, you're going to start, your hearing starts to go down a little bit, right? So you got to turn it up a little bit more to hear it a little bit better. And then your hearing may get a little worse. You got to turn it up a little bit more. Well, it's the same concept with your body responding to insulin. Over time, it starts to get a little deaf to the message of insulin. So your body is to crank out more insulin. And hyperinsulinemia leads to high blood pressure. It can lead to type 2 diabetes. It's been associated with even cancers and heart disease. Whether it's a direct cause or not, that's debatable, but certainly associated with it. So to be healthy and to lose weight in a healthy way, you want to lose weight in a way that is lowering your insulin level. And getting rid of carbohydrates is probably the easiest thing you can do to accomplish that. Or I shouldn't say getting rid of, but drastically lowering and improving the quality of. Whereas foods like proteins and fats, they don't have as much of an effect on your blood sugar or your insulin. Protein does a tiny bit, but not near the degree of carbohydrates, and doesn't contribute to the chronic hyperinsulinemia. So if you're looking for foods to eat that are going to be better for insulin levels and blood sugar, proteins and fats rank way higher than most carbohydrates, except for the very fiber-filled carbohydrates.
See, that is a very difficult concept to fully digest, no pun intended, because of the fact that for protein, not so hard. For fats, right, you always are told you are what you eat, right? So you're told that, listen, if you're eating fat, you're going to get fat, because again, if you're talking about a non-medical mind, you're thinking, I'm going to digest the fat, it's going to go in my body, and it's going to create more fat and just lop on, and here's another addition to my love handle, right? Versus just, I'm going to take in sugars that are going to be converted to fat by insulin. Can you speak a little to that?
Yeah, and that's a great point. And that is, boy, that's a myth that we being you and me, the medical community in general, right? That's a myth that the medical community has really been guilty of for a long time. And to oversimplify things, just way oversimplify things. If you eat fat, you're going to get fat. But it's not the case, because fat is a fuel, like anything. Carbohydrates turn into glucose, which become a fuel. Well, fat in your body is a fuel. The problem is when we're eating around the clock and we're eating high carbohydrates, our body never relearns how to burn fat for fuel. All we're burning is glucose. It's like the quick kindling. We're just putting the quick kindling on the fire rather than burning the logs that are the long-acting burning fuel. Well, that's what the fat is. And that's what we have to train our bodies to do, to be able to burn that fat for energy. Because then eating fat, you're not storing it. Eating fat, you're burning it. You're burning it for energy. And you can do that as well or better than you can with carbohydrates and glucose. We just need to flip that switch. So we flip that switch by eating less often and eating fewer carbohydrates. And then we train our body to burn fat, which is exactly what you want to do. Because look, we all have plenty of fat to burn. Even if we're in good shape and have 15% body fat, you still have plenty of fat to burn for energy plus fat that you're eating. So the concept that you are what you eat and you become fat by eating fat is totally misguided, unless you're eating a very high carbohydrate and high fat diet and overeating calories. Sure, that is a recipe for disaster, but that's been blamed on the fat, when in reality, it's the combination of the carbs, fats, and calories. It's not the fat alone. But you turn that around, you eat higher protein, higher fat, lower carbs, all of a sudden you're fuller, you naturally decrease your calorie intake, and you flip your switch in your body. So you start burning the fat for energy. And that's a healthy way to eat without gaining extra fat.
That helps quite a bit. Now, you mentioned before the word keto, right, as a potential type. You had made a distinction between that and low carb diet. So when you go on social media and you do a Google search and you do low carb diet, a few things are going to come up: keto, Atkins, paleo, amongst others. Are these all different names for the same thing, or are they really different versions of a low carb diet?
Yeah, if you look at it, low carb is the umbrella. Okay, low carb is the big umbrella. Keto is part of that. Atkins is part of that. Paleo is part of that. They're all under the low carb umbrella, but they all are distinct. So at Diet Doctor, we define 3 different versions of a low carb diet. And one is a very low carb or ketogenic diet. And that's less than 20 grams of net carbs per day. And that's going to put everybody into a ketogenic state, and that'd be a ketogenic diet. Well, what does that mean? That just simply means that you're burning your fat for fuel and you're producing ketones in your blood. Ketones are a byproduct of burning fat for fuel, but ketones themselves can also be fuel, especially for your brain and other parts of your body and your muscles. So it's any diet that produces ketones, which you can also get from fasting. Eating nothing and fasting will put you into ketosis. But a ketogenic diet is a diet that consistently leads to being in ketosis. Well, moderate low carb diet is 20 to 50 grams of net carbs, as we define it at Diet Doctor, which for some people will still be ketogenic, but not necessarily ketogenic in everybody. And then a liberal low carb is 50 to 100 grams of carbohydrates, which is not going to be ketogenic for most people, although you may sort of dip in and out of ketosis and still be able to burn fat for fuel, especially after an overnight fast or time restricted eating or whatever the case may be. So those are all 3 versions of low carb diets. Now, whether you're carnivore or vegan or vegetarian or flexitarian or Mediterranean or paleo, those can all fit within those parameters of low carb diets. The key is you're not eating 300 grams of carbohydrates per day, which is what some of these NHANES observational studies show the average American is eating, which is way too much, especially when you talk about the quality of the carbs and the ultra processed carbs that are in there. But lowering it to less than 100 grams of net carbs per day is a version of a low carb diet. But then what it looks like beyond that, it's totally up to you and what works best for your health and what works best for you to enjoy. Now, the question becomes, what are the benefits of being in ketosis versus just low carb? And that's also going to be a little bit different. But some people, like if you want to reverse type 2 diabetes or put type 2 diabetes into remission, if you're trying to treat a neurological condition like Alzheimer's or Parkinson's, or a mental health condition like bipolar disease, there's some evidence to suggest that a ketogenic diet and having ketones are more beneficial for those. Now, it's still an evolving field, right? There's still plenty of research being done, and it's not all that conclusive, but there's lots of encouraging and suggestive research that ketones and ketogenic diets are beneficial. But are they so much more beneficial than low carb diets for weight loss and metabolic health and sort of general health? Again, that has to be more individualized. I think the more unhealthy you are at baseline from a metabolic standpoint, the more you're going to benefit from more aggressive carb reduction and ketosis. But that doesn't mean you have to stay in ketosis forever. A lot of the patients I see, I may start with a ketogenic diet so people can really see the benefits quickly and really start to impact their health. And then over time, maybe loosen up on the carb restriction over the course of months or years, whatever the case may be, to go to more of a moderate or liberal low carb diet. So it's really this continuum of low carb diets.
That actually helps a ton. It is like a spectrum or a continuum, and it does also sound that it needs to be to some extent tailored to your needs. It's not just kind of what sounds the most appetizing or pleasing to you in terms of the pictures on social media. It's more like what might apply to my needs the most. So that actually helps quite a bit. And I'll get to that in a few minutes as well. If you had to, we talked a little bit about the bad carbs. If you had to, in the American diet, if you had to select 3 of the worst offenders in terms of bad carb foods, what would they be in your mind that you've seen people making mistakes over and over again, let's say?
Yeah, I mean, the first is not a food. The first is a drink by far. 90% of what people walk out of Starbucks with is just unbelievable how much sugar it is. And it just, there's no fiber, nothing to slow it down. It just goes straight into your bloodstream and is disastrous. Same for sodas, same for these quote unquote all natural fruit juices. The sugar in those, and the Gatorade. And I love that soccer star when he sat down and or was it Coke or Gatorade? I forget what it was, but he just moved it to the side and he said, "Drink water." And that was brilliant. I love that.
Right. Exactly.
Yeah, because we don't need that stuff. I mean, there's really, that is number one, far and away. You just should not be drinking your carbs and drinking your sugar and drinking your calories. I'm a regular guy at Starbucks, but for me, it's just a black iced tea or a black tea or black coffee. None of this other fruity stuff with all the carbs. It's ridiculous. So that's number one. That's got to go. Number two is it's the ultra processed foods that combine the fat, the carbs, the sugar, the salt together that really just stimulate you to want to eat more and more and more. So whether that's a donut, whether that's a bag of potato chips or whatever that looks like, those combined foods that are processed and designed specifically to hit your reward centers, to hit your taste buds. I did an interview on my podcast with Michael Moss, who writes a lot about this and about sort of the big food side of things and what they're doing, and talk about this bliss point. They have scientists doing experiments to find this bliss point of what tastes the best and has the best texture and triggers the best emotions. I mean, it's unbelievable, the research they do, all to hook you to want to eat more and more. So the best thing is just don't get started with that. So that's another big one that I think just needs to be avoided. And then, of course, I don't know when this is going to air, but we just passed Halloween, where it's the worst holiday in the world because we're just glorifying candy for these kids and sugar. So that's the other big one. It's not that, look, kids have to be kids. It's not like you can never do it, but really that should be limited as much as possible because of, the stimulation to eat more and just the pure sugar spikes and what it teaches them, that this is perfectly fine to eat on a regular basis, which should not be the case.
Yeah, it's interesting you brought up Starbucks because, two questions on that. One is that a lot of people go to Starbucks because they're like, I don't want to have a meal, but I need a snack. I'm hungry, so maybe this drink will tide me over. But it sounds like basically you're talking about with insulin levels spiking and stuff, it probably just make them more hungry sooner, right? To drink something like that.
Exactly. With that amount of sugar, your blood sugar can go up, and then your insulin goes up to meet it, and then your blood sugar goes down. And now we have evidence saying that as your blood sugar drops, you get a little shaky, you get a little hungry, you might get a little, brain fog and say, I need more food. I need something to get me going here. So it may have the opposite effect. And that's where things like, butter coffee or bulletproof coffee or MCT in your coffee, where those things have gotten popular. And people can go crazy and go overboard with those too, because that can be a lot of calories, but it serves a purpose. If you just need something to get you through to your next meal, or you're fasting, or you just want to feel a little bit fuller, then that can be a better option that's not going to impact your blood sugar and your insulin like the sugar drinks would.
Now, another follow up on that, and this is actually very interesting to me myself. Not that the rest isn't interesting to me, by the way. The coffee and tea itself obviously is not. I would assume just plain black coffee and black tea don't have carbs, right? They wouldn't
Correct.
impact us.
Yeah,
Right?
they have 0 calories. Yeah.
What about so a lot of people don't drink it black. They put artificial sweeteners, NutraSweet or stevia or whatever the heck, there's a million of them out there. Do those impact your insulin the same way sugar does? Does it have the same impact, or how does that work?
Yeah, so it's hard to just say, non-caloric sweeteners as one group, because there are differences. And again, we have guides on this with visual guides at dietdoctor.com if people want the details. But most of them do not, and that's the good news. Things like stevia or erythritol, which is a sugar alcohol, a new one called allulose, which is becoming pretty popular. A lot of those have almost no effect on blood sugar and insulin, so they're much safer from that standpoint. Some of the older ones certainly can. They can have an effect on insulin and glucose, although usually not the same as pure sugar. But the downside to these is what they can do is they can still stimulate your sweet tooth, that make you want and seek out that sweet taste. So in a perfect world, we wouldn't need any sweetener. But obviously some people, have a real hard time with black coffee, black tea. They want something enjoyable. They don't want to get rid of everything they enjoy in life. And that's something they really enjoy. So as long as it's not that slippery slope that's like triggering them to want more and more of that sweet taste, then I think it's perfectly fine to use some of those non-caloric sweeteners.
Perfect. Now, moving from coffee and tea to meat, if you go on social media and you go, with the exception of you, but you go to a lot of proponents of paleo to low carb diets to keto, on social media, there's inevitably a picture of a big steak, right? Like, this is what I had for dinner. Look at this tomahawk steak. It's delicious and it has butter on it. It's amazing. I mean, I just want to eat lunch right now just thinking about that. To what extent does meat play a role in a low carb diet? Because there's also people out there who don't eat meat or don't try to limit meat. How does that play into the equation?
Meat plays whatever role you want it to play. And that's the key thing, is that low carb and keto can be any kind of diet. Now, vegan keto is difficult to do, possible, but difficult to do. Vegetarian keto, much easier to do. Mediterranean keto, or liberal low carb Mediterranean, vegan liberal low carb. Those are, whatever you want to do. Carnivore also fits into it, right? So meat plays whatever role you want it to play. I love steak. I love ground beef. I had lamb chops last night. Meat plays a big part of my diet, but that doesn't mean to eat low carb you have to. People who like to focus more on the monounsaturated fats, will have lots of fish and lots of salmon, which I do as well. And maybe focus more on the chicken and less on the meat. That's perfectly fine. The key is, as long as you're making sure you're hitting your protein targets and keeping your carbs where it's healthy for you, then what form that takes is totally up to you. Yeah, but I think it is very clear the dangers of meat are far overplayed in the media, in the medical teachings, in unfortunately contemporary medical thought. The dangers of meat are far overplayed. And again, the Diet Doctor, we have a whole guide, an evidence-based guide on red meat specifically. When you look at the quality of the evidence against red meat, it is terrible. Like, if it were trying to get a drug approved or a drug, with that level of evidence, they would laugh you out of the room. But yet we're trying to make dietary recommendations for the whole world based on this poor quality, very low quality evidence. It just doesn't make sense to me. I think it's clear that the people pushing the agenda have ulterior motives for most of them, for most of it. But meat can absolutely fit into a healthy diet and be a big component of a healthy diet. But by no means you have to eat meat to eat low carb.
Got it. No, that actually helps too, because a lot of people, they don't want to eat that much meat, and they see it as a stumbling block. Now, this is going to be a hard question to answer, but because again, they're based on that spectrum or continuum you talked about. But if you're talking a middle of the road, low carb diet, can you give us an example on a high level, like what a day in the life of somebody on that type of diet would look like in terms of what they might be eating?
Sure. Yeah. So breakfast with 3 eggs with a bunch of spinach and broccoli and some avocado, nicely salted. That's a great way to start. And then lunch with a big salad with tons of veggies and with a piece of salmon on it with nuts and olive oil as a dressing. And then dinner can be a grilled steak, grilled chicken thighs, grilled chicken breast, and sautéed vegetables, broccoli, cauliflower, green beans, roasted Brussels sprouts, with avocado. And that's like a great place to start. That's a great diet. That's basically what that's my diet. So I think it's a good diet. But yeah, that's a low carb diet. I'm just calculating in my head, maybe that's going to be 50 grams of carbs for the day. So it may not be ketogenic for everybody. And then if you want a little treat, you have like a little bit of berries. Or if you're gonna do time restricted eating, you skip the breakfast and you can add some egg whites to your meals to increase your protein percentage or something like that. There are lots of different ways to do it. But it's funny, if you walk into your doctor's office and say, I want to start a keto diet, a lot of doctors are going to be like, no, you can't do that, it's going to kill you. But if you describe the foods I just described to you, most people would be like, I guess that's okay.
Right.
Like, so
well,
it's all about how you present it.
It's funny how you said that, because as you were saying, it sounds sounded pretty reasonable. I'm not a nutritionist, obviously. I don't have your background, but it sounded pretty reasonable to me. And I guess that speaks. I was going to ask you a question, but I think you kind of answered almost this, in the sense that a big pushback against these type of low carb diet is that they say that it's not a balanced diet, right? You're used to the pictures of the plate, and this much has to be from carbs, and this much has to be from protein, this much has to be from fat. That's when I was growing up in health class. That's where kind of I grew up on. But they say this doesn't exist anymore, right? In this diet, shouldn't, then it's really not balanced, and so it's not healthy. Can you speak to that a little bit?
Yeah, it's a total fallacy. Absolutely 100% wrong. I mean, look at the foods I described, spinach and broccoli and cauliflower and Brussels sprouts and green beans and salmon and nuts and avocado and meat. Like, what balance are you looking for that's not there? There's plenty of balance there. Now it's missing quote unquote healthy whole grains. You don't need whole grains to be healthy. There's nothing inherently healthy about whole grains. And this brings up the other important part. There are essential nutrients that we have to eat, that we cannot live without. There's essential amino acids found in protein. There's essential fatty acids found in fatty foods. There is no such thing as an essential carbohydrate. You do not need a carbohydrate to live or be healthy. So this fact that it has to be balanced and include some of these grains is absolutely false. It's just what's been propagated for the past 50, 60 years. And you can go down the rabbit hole of conspiracy theories of why that is and monetary theories of why that is. But basically, the truth of the matter is it's a fallacy. Now, observational studies show you can eat whole grains and you can eat higher carbohydrate diets and be healthy. That can certainly coexist. Mm-hmm. And, if you're baseline insulin sensitive and you're outside a lot and physically active and you're not overeating calories and you live in an environment that's not full of processed foods, absolutely, you can eat that and be healthy. But that is very different than saying these are inherently healthy foods that need to be included in a balanced diet. And that's the jump that we have made in nutritional guidance and medical teaching, which is just wrong. That jump should not be made. One does not equal the other.
Got it. Now, you had mentioned whole grains, and obviously this is for some people, it will be a big paradigm shift in their diet. Have you noticed when they switch to a low carb diet, do they have some adjusting to do in terms of, does it impact their digestion, whether it be like constipation or diarrhea? Does it affect, some people talk about headaches or muscle cramps. Have you experienced any of that with your patients, and how would you respond to that?
Yeah, so that's a real thing when you're going to a ketogenic diet. So if you're going to a liberal low carb diet, there's really not much at all that people experience. But when you're going a little bit further to a ketogenic diet, there is this concept called a keto flu or carbohydrate withdrawal, depending on what you want to call it. But basically, it's your body withdrawing from carbohydrates, making the switch from burning glucose to burning fat for fuel. And there's a process. It definitely takes time for your body to adjust. So you may feel crummy for the first couple of weeks. You may have headaches. You may feel fatigued. Those are sort of some of the biggest ones. But you can also, if you are ready for it and predict it, you can intervene upon it. So just hydrate, because you actually do become more dehydrated during that period. So you really have to keep up with your hydration, and supplementing with electrolytes, salt, magnesium, very important to help with that as well. And I don't mean to be a commercial, but we have this at Diet Doctor as well. We have a whole guide on Keto Flu and things to do to prevent it, and what to expect, because it is a real thing. So the last thing I want is someone to say, oh, I'm going to try this low carb diet, and then be a couple of days or a week into it and say, I feel awful. This is terrible. How does anybody do this? You need to know that there is a transition period. And then once you're past that transition period, it's gone and you're golden. But there are things you can do to make it much easier so that you hardly even notice it at all.
Got it. And to that extent, so now we're talking about the keto flu or whatnot. Are there people for whom low carb diet wouldn't be appropriate if you put your medical hat on? Or are there people who would say, you know what, this is really not for you, buddy? Who would you think of? Who comes to mind in that situation?
Yeah, great question. I'm glad you asked that. So the first most important thing is not maybe that it's not for you, but it's not for you without close supervision. And that's anybody on medication to lower your blood sugar. So certainly anybody on insulin, anybody on medications called sulfonylureas or SGLT2 inhibitors, any medication that's going to lower your sorry, did I say lower your insulin? I meant lower your blood sugar. I can't remember if I said that correctly.
No, you said blood sugar. Yeah.
Okay. Any medicine that's going to lower your blood sugar, specifically insulin being one of them, because low carb diets work so well to lower your blood sugar that if you're also taking medication to lower your blood sugar, you can get dangerous hypoglycemia, which is very dangerous. So if you're on medication to lower your blood sugar, you have type 2 diabetes or type 1 diabetes, you have to have a plan with your physician, your healthcare provider ahead of time on how you're going to adjust your medication. And we have a guide for this at untitled.com to help your doctor, because your doctor may not be aware of that. So you can certainly direct them to our website. We also have a find a doctor website for people who are very well versed in low carb nutrition, who this is secondhand to how to do this. So that's number one, that you need a plan from that standpoint. Otherwise, there are very few people who shouldn't do it. If you're pregnant, you gotta be more careful, because we just don't have studies one way or the other. We don't know about pregnancy, although it makes sense if you have, I guess this is mostly a male dominated audience, so maybe they're not so interested in it, but gestational diabetes, low carb could potentially work for. So, but be careful with pregnancy, obviously. If you have eating disorders, sometimes this can, any type of a restricted diet can trigger eating disorders, although there are case reports published about how low carb diets can actually help eating disorders. So there it sort of can go either way. It's very rare. People can have these rare genetic defects where they can't metabolize fat well. And those are really the only people who can't do a real low carb diet. But you would probably know that at this point, because those are pretty rare and pretty severe diseases when it comes to not being able to digest fat. But otherwise, anybody really can do it. But obviously, if you have any medical conditions or being treated with medications for things, just check it out with your doctor first to make sure it's not going to interfere with your health from a medicine standpoint.
What about people that have underlying, let's say, high cholesterol, right? And they're on statin for cholesterol, or maybe they have heart disease, maybe they have coronary artery disease or high blood pressure. Why do I bring this up? Because again, also, if you do a Google search or go on social media, a lot of concerns about low carb diets is not so much the low carb, but the substitution with fat, right? And fat is like, you're thinking about fat, it's going to clog my arteries, it's going to make my heart disease worse, it's going to raise my cholesterol, going down a whole rabbit hole of this issue. Should people with those type of conditions avoid low carb as well?
Yeah, another great question, and absolutely not. There's no absolute reason why anybody with heart disease needs to avoid low carb. Now, that being said, it deserves to unpack a little bit more. So the overwhelming evidence of people with type 2 diabetes or people who are overweight, trying to lose weight, who go on low carb diets, they have no increase on average in their LDL cholesterol. And that surprises a lot of people, because the concept from physicians is if you go on a low carb and you start eating that fat, your LDL is going to skyrocket, guaranteed. Right. So you cannot do it. The evidence shows exactly the opposite. The majority of people do not have any bump in their LDL. And in fact, there was a recent study that showed on average LDLP, the particle number, went down. One of the studies out of Virta Health showed their calculated cardiovascular risk went down. And that's because your triglycerides go down, your HDL goes up, your remnant cholesterol, the VLDL, which are probably more atherogenic than LDL, that goes down. Your metabolic health improves. You can see all these improvements that decrease your cardiac risk. So why would you not want to experience those improved cardiac risk factors for the fear that your LDL might go up? Well, then there's a subset of people whose LDL does go up. So it does exist. It's just important to emphasize that it's the minority. So if that happens, now we're into this little bit of a wild west of unknown what's going to happen. There's reason to believe that it wouldn't be as concerning or dangerous as LDL going up for other reasons, but there isn't strong conclusive evidence to prove that, right? So there's reason to believe it. There's reason to have a hypothesis, but there's not strong evidence. There is a study going on right now. Citizenscience.org, I want to say, is the website for it. It's Dave Feldman and a couple of people he's collaborating with to do a study on the so-called lean mass hyperresponders. So people who go on a keto diet and their LDL shoots up through the roof, they want to study it to say, is this contributing to more aggressive plaque formation? But there's evidence out there showing that if your triglycerides are good and your HDL is good and you have good metabolic health, that your risk from elevated LDL is not the same as if it's the opposite. It's a much lower risk, if at all. And that's what we just need to study this subset of people more. So for now, for the time being, since we don't have conclusive evidence, you got to treat every case individually. If your LDL goes up, you got to decide for yourself and with your physician what the right thing to do is. But I think it's a fascinating field that we're going to get more evidence coming out of, that maybe it's not the same, and maybe LDL doesn't have the same impact for all people.
And so with that being said, does it make sense for people before and maybe a little while after starting a diet like this to check their cholesterol or triglycerides? Is that something that's recommended generally?
Sure, absolutely. Yeah, I mean, you definitely want to follow what's happening with your blood sugar. You definitely want to follow what's happening with your cholesterol as well. But here is where cholesterol checking is important to know more than just the basics, right? So you're not just looking at your LDL, you're looking at your HDL and your triglycerides as well. Because if your LDL goes up a little bit, but your triglycerides go down and your HDL goes up, that could be a net benefit. The other thing is, if you can have access to it, this is where I'm a big fan of advanced lipoprotein testing, specifically knowing the size of your LDL particles. And contemporary cardiology is sort of down on that to a degree, because if you're taking a statin, if all you care about is do you qualify for a statin or not, then it doesn't really matter what the size of your particles are. But if you're looking to see what impact your lifestyle and your nutrition has on your lipids, then absolutely you want to know the size of your particles, because a lot of the times what happens is your LDL can go up a little bit, but your ApoB or your LDL particles doesn't change at all. So let's talk about that for a second. LDL cholesterol is just the total amount of cholesterol in your body. But LDL particles is the number of LDL particles. ApoB is sort of similar. It's another measurement for the number of particles. Those are better predictors of cardiovascular risk than just LDL cholesterol. The analogy is what causes traffic, the number of people in the cars or the number of cars on the road. Well, the number of people in cars is the amount of total cholesterol, just how many people there are on the road. But the number of cars on the road are the number of particles. So that's what's more impactful. So my long-winded way of saying LDL can go up a little bit, but LDL particle number can go down. And that's sort of the better approach of where you want to be. And that you can see with low carb nutrition. So that's my commercial for saying people should get this advanced lipid testing if they can, to learn more about their lipids than simply what is the LDL doing.
But either way, it definitely sounds like this should be done under some supervision or observation by a healthcare professional to some extent.
Absolutely, absolutely. And again, if someone's not familiar with low carb nutrition at all and what can happen, people are easy to find online who are more familiar with this, and there are a number of them do video consultations and so forth to sort of help you interpret your numbers. Yeah.
Got it. Now, there's a lot of diets out there outside of low carb that are kind of vying for people, like in terms of weight loss or health. You're talking about plant-based diets, intermittent fasting or whatnot. First question, like again, with plant-based intermittent fasting, it sounds like this could be working with that, right? Versus a competitor. Not to say you're competing with anybody here or anything, but this is kind of sounds like it could be synergistic. It could be a combination, a hodgepodge of different types of approaches. Is that correct?
Absolutely, absolutely. I mean, plant-based could be the most horrific ultra processed, refined, terrible diet, or plant-based could be a very healthy, low carb, whole foods diet, right? Either one can be quote unquote plant-based. So, and same with keto and low carb can be tons of processed and not so healthy, or whole foods based and healthy, right? So they do work together, absolutely work together. And then of course, intermittent fasting can work with any dietary pattern. But plant-based can absolutely work with low carb. One thing interestingly about intermittent fasting though, and this is something that me and a number of my colleagues have found, is that intermittent fasting tends to work better on low carb diets, because when you eat a low carb diet, studies show you naturally decrease your calorie intake. You just feel fuller, especially if you're getting enough protein. The protein fat combination with lower carbs just makes you feel fuller. So probably the most consistent finding people will report to, my patients will report to me, or other clinicians, their patients will report, is I'm not hungry anymore. I don't have to eat every few hours. I can skip breakfast, I can skip lunch, and all of a sudden I realize I haven't eaten. I better eat today. You know, like that is like so revolutionary for people who are just part of this hamster cycle of constantly needing to eat because they're hungry. And that goes away for the majority of people on a low carb diet, which is pretty impressive. So that's why it works even better for time restricted eating if I think you're on a low carb diet.
Got it. And, you know, we've talked a lot about eating, but to what extent does exercise fit into this whole regimen?
Yeah, so important. So exercise has kind of done a 180 also, being like, you know, in the 70s and 80s, everybody's got to be a runner. That's how you lose weight. That's how you get healthy. And now it's come 180 to you can't outrun a bad diet. Exercise is terrible for weight loss. And I agree with that. If you want to lose weight, just exercising isn't going to do it. But if you want to lose weight in a healthy way, exercise is crucial. Okay, so that's the exercise nutrition combination. And what I mean by losing weight in a healthy way is you don't want to lose muscle mass. You can starve yourself and go on these just super low calorie diets and lose fat and lose your muscle mass and lean body mass. That's not healthy weight loss, because that's when your resting metabolic rate goes down. And all of a sudden you have to keep eating fewer and fewer calories just to maintain your weight loss. But if you can maintain your lean mass by doing exercise, by eating a diet that gives you plenty of protein and plenty of nutrition, and doing resistance training plus some cardio or high intensity, that's the combination that's really gonna survive, that's gonna do its best for healthy weight loss, where you're maintaining your resting metabolic rate, you're maintaining your lean mass, and you're losing mostly fat mass. So I'm a huge proponent of exercise when the person is ready to help make weight loss healthy weight loss.
Got it. No, that's actually such an important point. And then one thing about diet, anybody talks about diets, right? There have been so many, and I don't consider this a diet. I consider this like an approach to nutrition. But, you know, if you're talking about fad diets out there, the biggest question that people have is, yeah, that sounds great for a week, but then I can't handle this. You know, this is nothing I can be sustainable. I can't eat regular like this. I'm not a multimillionaire who has a personal chef. This just doesn't work for me, right? How durable is a low carb diet?
Yeah, it is incredibly durable, because one, it's so easy. You don't have to think about what you're going to eat necessarily. You steam some veggies, you throw a steak on the grill, boom, done. I mean, that's so easy to do. Now, in today's society, it can be a challenge because you've got taco shops everywhere, you've got pizza shops everywhere. Everybody's, eating crackers and candy and junk food, and so it's that allure. People say I can't live without my bread. Was it Oprah's like famous saying was like, I can't live without my bread? Of course you can live without your bread, but some people choose to, that they just have such a strong pull that they want to eat more carbs. So for those types of people, it can be more of a challenge. And there are things like carb cycling, cycling in and out of low carb diets can be helpful, or just, slowly stair stepping, taking your time to get down to lower and lower carbs can be helpful. But I mean, the world is full of people who've been doing very low carb ketogenic diets for years or decades, and it's completely sustainable. I think the only one thing that is really not sustainable is if someone becomes like bored with the diet, or just craves too many carbs. But in terms of, I don't know, being enjoyable, being logistically easy to do, it works for so many people. Yeah, and definitely can be long term.
Perfect. A couple of take-home questions to finish off here. The first one is kind of a summation question, right? In medicine we talk about informed consent, anytime you have a patient and you're offering them a medication, a procedure, anything, we talk about the risks and benefits. I'm coming into your office saying, Dr. Sher, I'm interested in this. Counsel me on the risk and benefit. If you had to take 2 minutes and just say, counsel me on the risks and benefits of a low carb diet.
Yeah. Well, so first and foremost, like I mentioned before, if anybody's on blood sugar lowering medications, that's the first thing you have to address. Absolutely. And you have to come up with a plan for how to adjust those medications. Blood pressure medicine is similar, but less dramatic, because you can lower blood pressure too much as well, but less immediate, less dramatic than the blood sugar. So assuming that's off the table, then the benefits are losing weight, improving your metabolic health, and decreasing your hunger, being able to improve the space, the time between your meals. And for some people, not everybody, but for some people, increase energy, increase cognition, and sort of being mentally sharper and clearer. But pretty much everybody gets the decreased hunger, losing weight, and improved metabolic health. So those are some pretty powerful benefits. The risks and the downsides, like we talked about, the initial 2 weeks of a keto flu if you're going all the way to a ketogenic diet, but there are certainly ways you can predict that and prevent that. Otherwise, very, very few risks or concerns. And we'll follow your blood tests to make sure you're responding appropriately and not having any concerning things that come up. And that's really it. I mean, it really is not many risks or concerns, and certainly none that you can't easily diagnose and steer clear of once they come up.
So that actually helps a lot. And a lot of guys just listen to all this and they said, this sounds pretty darn fantastic. I like it. I want to try it. But then the ultimate problem comes in. How do I try it? Where do I begin? What do I do? We just talked about, well, maybe there's blood tests involved, and maybe I need to be tracked, and I don't know where to go. Do I go to my doctor? My doctor may not even believe in this. They're going to say, foo, to get out of here. Go. Let me show you the plate with the different segments on it. Rather than that, or do I talk to a nutritionist, or do I go on Diet Doctor? What do I do to reasonably start this process?
Yeah. Well, I think starting at Diet Doctor is a great place, because that's how you can really help educate yourself even more. If you have the means and want to work with somebody individually, that's great, because then you can have that individual guidance. And then there's we have the whole map with over 700 clinicians at dietdoctor.com, where you can find somebody who's well-versed in low carb to help you. If you want to do it on your own and don't want to hire somebody to help you through it, then we have guides to help you. But really, all you have to do is focus on whole foods, comes from a ground, comes from an animal. It's good. It's not in a factory. It's not processed. Focus your carbs on vegetables that grow above the ground. That's where the majority of your carbs are coming from. And then mix and match and make some meals that are pleasing to you. If you want more guidance, we have over 1,000 recipes at Diet Doctor. And in terms of labs, you can do it after your general checkup with your doctor. Your doctor doesn't have to know you're doing this, of course, with the medication caveat. But you might as well let your doctor know. And if they're hesitant, if they're skeptical, I'm a big fan of bringing your doctor into the fold and requesting their help and saying, look, I know this might not be what you recommend, but I've read a lot about it. I really want to try it, and I want your help in helping me make sure it's working appropriately. So will you be on my team with this and help me? Let's check things now. And will you help me check again in a few months to make sure we're on the progress? Because then it's hard to argue with that, right? What doctor would argue with that? Like, oh, you're asking for my help. You want to make sure it's safe. Okay, I can do that, right? Like, be part of a team with your doctor the way it should be. And in terms of what labs to check, how often to check, again, we've got all that at dietdoctor.com. So, at Diet Doctor, we really do want to be that one-stop shop to help everybody find what they need, the education, the guidance, the recipes, the meal plans. It's all there for you and for your clinician.
No, that's actually a great approach. Dr. Sher, thank you so much for this. This has been extremely informative. I'm sure the guys out there are kind of, their heads are spinning with kind of all the new information they've picked up in a very good way. I'll leave you today with a question that has absolutely nothing to do with low carb or any other type of diet. Your story is a pretty amazing one in the sense that you started on a path and you realized it may not have been the right path, and you found your best path, and your passion and your excitement is palpable. For the other guys out there who aren't at that point where you are right now, what if you had to hone it down? What is your secret to success?
Oh boy. Yeah, I mean, you sort of hit it there though. It's finding your passion. Now, I wish I could come up with a plan of how everybody finds their passion. And
Sure.
I don't know how to do that other than to listen to yourself and don't do things because it's what you feel you're supposed to do, or what other people are doing. You really have to blaze your own trail, and don't be afraid to do that, because you have to follow your heart. And if you're not following your heart, if you're not following your passion, you got to change what you're doing, because life is too short to not be doing what you love and following your passion. And for me, it's helping people in this way. So for you, you've got to find out what it is, but that really is the key. And once you find that, the rest is easy, because then the rest is fun, the rest is enjoyable. And that's a story we hear so much on physicians and clinicians that have just revitalized their enjoyment, by finding a different way of helping people. So that's what it comes down to: finding what you love to do.
Excellent words to live by. Dr. Sher, again, thank you so much for joining us. It's been a fantastic conversation. And to all of you guys listening and watching out there, remember our mantra here at Better Man Clinics: your best life is a journey and not a destination, and use every single day to get just a little bit better. We'll see you all next time.